Testing, testing. 1, 2, 3, testing. Testing. Testing, testing. 1, 2, 3, testing. Dr. Ferrer's mic. Testing. Okay, good. And then I'm going to try that on the mic. Good. Testing, testing. 1, 2, 3, testing.
That was the other one. It's on a delay.
Okay. Thank you. Good afternoon and welcome to today's COVID-19 media briefing. And thank you for braving the weather. I hope everyone watching today stays safe and warm. As I go over this week's COVID information, I want to note that there are many people within LA County who still feel the impact of COVID-19, including from long COVID, which I'll talk about today, and we'll share some resources. We'll continue our efforts to provide people the information they need and work to ensure that support is available, especially for those at highest risk. Next slide. At the beginning of each briefing, I like to give this overview of our trend lines, offering us a comparative view of where we are right now with the COVID-19 pandemic. On this slide, we have cases, hospitalizations, and deaths from April 1st of 2022 through today. The green trend line shows the 7-day average of the number of cases reported daily, and it's measured using the vertical axis on the left. The average number of reported cases is about 1,000 per day, and that's similar to the 7-day average of 1,050 cases that we reported last week. As a reminder, due to at-home testing, this trend line gives a fair overview of patterns we're seeing in transmission, yet it doesn't capture all or even likely most of the cases in LA County. The orange trend line shows the 7-day average number of hospital admissions. This past week, there was an average of 109 admissions per day, showing little change from the 106 admissions per day last week. While overall this number has dropped by nearly 50% from the number of hospital admissions we were seeing in early January, it's still higher than it was last October, when we averaged under 70 hospital admissions per day. The blue line on this slide shows the 7-day average number of deaths reported daily, and it's measured by the axis on the right. We're currently reporting an average of 15 deaths per day, a slight decline from the average of 17 deaths reported per day last week. While we're grateful that deaths are not higher, as of today, more than 100,000 people in the state of California have died from COVID-19. Here in LA County, over 35,600 residents have passed away from COVID. Locally, COVID has caused more deaths from 2020 through 2022 than any other leading cause of death, with the exception of coronary heart disease. COVID also caused over 10 times more deaths than motor vehicle crashes during this 3-year period. Nobody anticipated this 3 years ago, and the toll weighs heavily. To those who have lost family members and loved ones to COVID-19, I offer my sincere condolences, and I hope that you find peace and healing. Next slide. Using CDC's community levels framework, which looks at the case rate and 2 different hospitalization metrics, this week LA County remains in the low community level for the 6th week in a row, with a reported case rate of 69 new cases per 100,000 people. It's a little bit lower than what we reported last week at 72 new cases per 100,000 people. For the first hospitalization metric, the number of new COVID-19 admissions per 100,000 people, LA County is currently at 7, and this is slightly lower from the 7.5 we reported last week. For the second hospital metric, the percentage of staffed inpatient beds occupied by COVID-19 patients, LA County is currently at 3.9%, and this is the same as what we reported last week. Next slide. As we try to anticipate community spread more accurately, we look at wastewater data to provide an early indicator of transmission levels. In this slide, we have SARS-CoV-2 wastewater concentrations from September 11th of 2022 through February 11th of this year. You may notice that the graph looks a little different this week. We've made some changes to utilize data from the growing Wastewater Scan, or Sewer Coronavirus Alert Network Collaborative. We're happy to switch to this data because it utilizes robust methods developed by experts at institutions such as Stanford and Emory, and has investment and support nationwide, making it a sustainable and reliable source of this data for the future. Previously, wastewater concentrations were measured as a percentage of the peak concentration seen during the summer 2022 surge. Since data from this new source is only available starting in September of 2022, we'll now be reporting wastewater concentrations as a percentage of the peak winter concentration, which occurred during the week that ended December 10, 2022. The wastewater concentration peak during the most recent summer and winter surges were very similar, so the interpretation of this metric and our thresholds for medium and high concern remain the same. The new wastewater scan data includes samples from the Joint Water Pollution Control Plant, Hyperion, and the Lancaster sewer sheds. The blue line is a weighted average for viral concentrations across these 3 wastewater treatment plants, weighted by the population served by each plant. The most recent wastewater data we have is from samples collected during the week that ended February 11th, since it takes time for these samples to be analyzed and reported to us. Looking at the main graph, it's clear that our current wastewater concentrations are substantially lower than what we saw during the peak of the most recent winter surge. This week, the concentration level is 31% of the winter peak, placing LA County right about at the medium concern threshold for wastewater concentrations, according to our own early alert metrics. We remain at concentrations that are currently lower than the winter peak and stable since mid-January. While the good news is that we're not seeing increases, we're also not seeing the continued declines. The bottom graph in the corner, the green line, shows the wastewater concentrations from the Tapia sewer shed. We're now presenting this data separately because it's analyzed by a separate lab than the one that's used for the 3 other sewer sheds. For the Tapia sewer shed, we're seeing the same pattern, with concentrations substantially lower than the winter peak and relatively stable since mid-January. COVID is still circulating. These aren't low levels. However, the current transmission is not driving higher rates of hospitalization, indicating that our tools to prevent severe illness from COVID-19 continue to work well, including the bivalent booster, therapeutics, and at-home tests. We're committed to continue to make these tools easily available. Next slide. Circulating COVID strains can tell us a lot about what to expect from COVID-19. We've become familiar with dominant strains, the impact, what tools work, common COVID symptoms, and how to mitigate the disease. New strains or variants can disrupt these known patterns, and often they drive a surge in cases by evading prior immunity or increasing the potential for infection. On this graph, you can see our variants as a percentage of all specimens sequenced in LA County as of February 4th. There's a 2 to 3 week lag in the lab data due to the time it takes to sequence the specimens. Strains circulating now, as you can see, are all descendants of Omicron, and we're not seeing new variants or rapid rise in any of the strains. XBB.1.5, the orange section at the top of the bar, accounts for about 45% of sequenced specimens in LA County as of February 4th, and that's an increase from the week before. It's not unexpected that this strain is gaining dominance. In some parts of the United States, it currently accounts for over 95% of sequenced specimens. Here and in other parts of the United States, the rising dominance of XBB.1.5 does not appear to be correlated with more hospitalizations or more deaths. The strain XBB, that's the yellow portion of the bar, accounts for about 6% of our sequenced specimens. And this is pretty typical of what we've been seeing since mid-November. Previously dominant BQ.1.1, that's the purple bar, now, as you can see, accounts for only 23% of sequenced specimens. And finally, CH.1.1, the newest strain that we're tracking, shown by the light blue bar, is at just over 1% of sequenced specimens. The CDC does calculate predictions of the estimated proportion of each COVID strain circulating now, since there is that 2 to 3 week lag in the lab data. For Region 9, which includes California, in addition to the other nearby states, the CDC predicts that XBB.1.5 currently accounts for just over 70% of COVID cases, and it's over 80% across the United States. We'll continue to watch the ways these strains interact and change, as well as track for any new variants that could potentially come along in the future. With the data confirming that we're not seeing any newly emerging strains that are rapidly outcompeting other strains, we can trust that our tools and common sense mitigation measures can continue to lessen the impact of this disease. Next slide. While there's much relief in knowing that the strains currently circulating are not causing the severe illness associated with earlier times during the pandemic, Many people in LA County suffer from long COVID. Long COVID, sometimes it's called post-COVID or post-acute COVID or long-haul COVID, is, as defined by the World Health Organization consensus definition in 2021, the continuation of signs, symptoms, and conditions of a COVID infection for 4 weeks or more after the initial phase of infection. Often it involves overlapping conditions, a relapsing pattern, or conditions that are worsening over time. People with long COVID are not contagious, meaning they can't spread COVID. Often there's a wide range of overlapping symptoms that may be ongoing or that may continue to return. Long COVID doesn't affect everyone the same way, and there are different combinations of symptoms, including general, respiratory and heart, neurological, digestive, or other types of symptoms. Most people with long COVID slowly begin to improve. However, there are also people who have had long COVID for many months or even years, sometimes resulting in a disability. Some general symptoms include extreme fatigue, a worsening of symptoms after physical or mental exertion, or a fever. Common respiratory and cardiac symptoms include difficulty breathing, a chronic cough, chest pain, or a pounding heart. There are many possible neurological symptoms, including brain fog, the ability to focus, sleep problems, changes in taste and smell, dizziness or a feeling of pins and needles, depression, or anxiety. People may also experience digestive symptoms, joint or muscle pains, or a change in their menstrual cycles. Next slide. Through the Household Pulse Survey, which is a CDC partnership with the U.S. Census Bureau and the National Center for Health Statistics, questions were recently included to help assess the prevalence of long COVID, in addition to other information about the COVID-19 pandemic. The survey is repeated with U.S. households at regular intervals. Since June of 2022, the survey has included the question, did you have any symptoms lasting 3 months or longer that you did not have prior to having coronavirus or COVID-19? On the chart here, you can see the proportion of people who experience long COVID as a percentage of adults who ever had COVID. Based on the results from the most recent period, which was January 4th through January 16th of 2023, CDC estimates that 28% of people who have had COVID experienced long COVID. When people were asked, do these long-term symptoms reduce your ability to carry out day-to-day activities compared with the time before you had COVID-19? 79% of people currently experiencing long COVID responded yes, they had some sort of limitation. This means that nearly 4 out of 5 people experiencing long COVID are experiencing limitations 3 months or longer after their initial infection. More than 1 in 5 people, or 23% of those currently experiencing long COVID, reported that they have significant limitations. It's sobering to see how so many people are still affected by long COVID nearly 3 years into the pandemic. Next slide. A similar study has been done to look specifically at LA County, and you can see the results on this slide. This study is led by the USC Pandemic Research Center in collaboration with LA County Department of Public Health. Results on this slide are from what we call Wave 4 of the study, which was administered between January and February of 2023. I want to thank the team at USC for this partnership and all their work to make sure this information is available. In this survey, participants were asked, did you experience any of the following symptoms that lasted for more than 3 weeks after your original COVID-19 infection? Of the 675 participants who responded to this question, less than half of the people said that they were completely recovered from COVID within 4 weeks. The most common symptom was extreme tiredness or fatigue. 27% of people reported this, followed by just over 20% of people reporting that they were still experiencing brain fog, and nearly 19% of people who reported a consistent cough. When asked how much do or did these symptoms prevent you from going about your usual daily activities, such as going to work or school, socializing with loved ones, or taking care of your personal needs, 77% of people reported that they had limitations, and 25% of people reported they had significant limitations. This is very similar to the estimates we just looked at that were provided by the CDC Pulse survey. Oftentimes, COVID is reduced to the experience when a person is infected. Was it severe? Did you have to go to the hospital? How long until you tested negative? This data shows us that for some people, the impacts of COVID can last much longer than the initial acute infection. Next slide. No one's immune to long COVID, even if you're healthy and even if your infection is mild. With that being said, there's continuous research on post-COVID conditions. And based on this, according to the CDC, there are individuals who are more likely to get long COVID. This includes people who have experienced more severe COVID-19 illness, especially those who were hospitalized or needed intensive care. It also includes people who had underlying health conditions before they got COVID infections. It includes people who didn't get a COVID-19 vaccine, and it includes children who experience a multi-system inflammatory syndrome during or after COVID-19 illness. As we move into the next phase of the pandemic, these individuals join others who are the most vulnerable. If you're a person that fits one of these categories above, please consider taking sensible precautions to prevent COVID-19 infections, minimizing your risk for long COVID. Next slide. We are fortunate to have resources in LA County for people who are experiencing long COVID. If you have symptoms exceeding 4 weeks, or you're facing severe limitations in your daily activities a month after a COVID infection, please reach out to your healthcare provider or to a clinic that specializes in long COVID recovery and rehabilitation. Cedars-Sinai has a program focused specifically on cardiac long-term recovery and a general COVID-19 recovery program. There are also programs at USC and at Children's Hospital in Los Angeles. In Tarzana, there's the Valley Comprehensive Outpatient Rehabilitation Facility. And there's RTHM, a virtual clinic, which may be a good option for people who have time or transportation constraints. This list is not comprehensive, and there are a growing number of providers in LA County who have experience working with patients who have long COVID. Oftentimes, if you have a medical provider, that is a good place to start. Our public health call center also offers well-trained staff who are prepared to answer questions about long COVID and who can make referrals to local clinics and providers. You can call 7 days a week between 8 in the morning and 8:30 p.m. That number is 1-833-540-0473. Next slide. For many of us, it does remain important to still take practical steps to avoid infection, especially if you're older, you have underlying health conditions, or you're in one of those groups that's at higher risk of developing long COVID. The best way to prevent long COVID is obviously to avoid getting infected or reinfected. When you are out doing the activities you love, assess the situation, who will be there, potential exposures, and implement common sense protections when they're warranted. When you have possible COVID symptoms, you know that you were exposed to COVID, or you think you may have been, test as soon as possible to detect a possible infection early. Free test kits are still available from covidtest.gov, and insurance policies are currently required to cover the cost of 8 tests per month. When you test early, it allows you to seek therapeutics as soon as possible after infection. When started within 5 days of your symptoms, these medications can significantly reduce the risk of severe illness. You can speak to your provider. If you don't have a provider, again, call our free telehealth services, 1-833-540-0473. It's also, as always, important to stay up to date on your COVID vaccines, including making sure you've had the bivalent booster. The bivalent booster has been known to reduce the likelihood of a severe infection, and that, in turn, potentially lowers your risk of developing long COVID. In closing, as we have experienced throughout the pandemic, there are no absolutes. There is a temptation to say the pandemic is ending, and for some, this experience is very real. For others, they continue to feel the impact daily, whether it is living with the loss of a loved one, the economic toll of the pandemic, or the effects of long COVID. At Public Health, we've made a commitment to not leave these people behind. The fact that we didn't see a large winter surge and that our hospitalization and death rates have remained stable is positive, and I'm optimistic about this next phase in the coming months. As we lift our emergency orders, public health will continue, however, to work to ensure that the public is informed, resources are available to limit transmission and severe illness, and that we'll all be prepared to move forward together. Next week, I want to note we won't have a COVID media briefing unless something pops up. So our next briefing will be March 9th. But thanks for being here today, and I welcome your questions.
Hi. Sure. Yes. Thank you so much. You used the phrase "next phase of the pandemic" a couple of times. What does that mean to you? What is the next phase of the pandemic?
I think the next phase is where we're at. You know, our tools are working really well. Fortunately, less hospitalizations, less severe illness, and less deaths. You know, that's why we constantly want to show that opening graph so that everyone can see what we see. Is, you know, while we still have lots of people, unfortunately, across the country dying, it's so much less than what we've experienced in the past. And it's reassuring to know our tools keep working and that the mutations, which is always sort of the unknown for us, for the last few months, they've all been mutations of the Omicron variant, which is, again, allowed us to have tools that continue to work very effectively at protecting us. So I think that's the next phase, you know. Still, you know, when you look at the death toll, it's high. And we want to make sure everyone has the ability to maximize their protections. But it is very different than what we experienced, you know, the winter before.
Well, speaking of deaths, you made a point about more than 100,000 in the state, more than 35,600 here in the county. Can you give a profile, though, of who is the 15 people who are dying a day here, sadly, in LA County, who that is?
Yeah, we tried to show some of that a couple of weeks ago, but I'll summarize. I mean, it's primarily older people. A lot of them are, in fact, much older. It's also people who have underlying health conditions. I will say, you know, tragically, a quarter of the deaths are not amongst that older group of folks. They're amongst people between the age range of like 50 and 75, and some even younger folks. I mean, nobody's immune, and we all have stories of, you know, perfectly healthy people who were younger who passed away. So again, I think, you know, we still have steps we can all take, sensible steps. We can go do everything we love now, which is such a relief. Some people have to really take some precautions, and other people just have to acknowledge the risks and the benefits.
Because COVID is here to stay.
Because COVID's here to stay.
Yeah.
COVID's here to stay, at least for now. I mean, I'm excited by, you know, the opportunities that researchers have to give us a better vaccine, which I think, while COVID may be here to stay, will dramatically reduce our risks and really deal with the issue of the rapidly mutating virus. So, you know, I think that's encouraging. I was reading some studies of new therapeutics that are in a phase 3 trial. You know, we always are going to want to make sure we've got therapeutics that work for whatever's circulating. And, you know, we've lost some therapeutics over time during this pandemic, whose therapeutics that no longer work with the strains we're seeing now. So, you know, I'm encouraged that we continue to see our researchers, you know, really, in some ways, doing miraculous work for all of us.
The 10-day close contact mask mandate, I asked you about that last week.
Yeah.
Any updates on once the county's declaration lifts, will that lift too?
I mean, it's a great question. It gives me an opportunity to just talk. You know, the board will be talking, you know, discussing this upcoming Tuesday, a motion that was introduced by Supervisor Hahn that would lift the emergency declarations. There are two here. One is the health emergency declaration. The date that's being proposed, and again, the board needs to make this decision, but the date that's being proposed in this motion would be at the end of March. So by the end of March, some of the health officer orders that were written here in LA County by Dr. Davis, our health officer, would in fact need to be changed if they were going to continue, because some of them were done under an emergency declaration. There are other health officer orders that aren't done under emergency declaration. So I want to be sure that everyone is clear that a health officer always has authority to mitigate the impact of communicable diseases. And you've seen that. I mean, we may not have recognized it as a large community, but we've all experienced that when there are other outbreaks in other diseases.
Is the 10-day close contact mask mandate under the emergency
The
order?
10-day close order mask mandate is under that emergency declaration.
Theoretically, it should be
So
lifted.
theoretically, it would be lifted unless we issued a new health officer order that was really directed at a group of people who had exposures, known exposures.
Meaning for the school children and...
It would mean, you know, right now it's for the public. I mean, but it's not a masking requirement for all of us. We don't all have to wear masks. Only those people who've had an exposure for that 10-day period.
You and Dr. Davis will...
We're going to work with our teams. You know, we're obviously looking at, you know, anticipating some new guidance coming down from the state as well. I want to note that some of the requirements that are in place that we get asked a lot about, masking at healthcare facilities, you know, those are state orders. And we're anxiously waiting, like everyone else, to see if there'll be changes there.
I have two long COVID questions from Luke Money at the LA Times. His first question, what is the latest thinking on the root causes of long COVID and what progress is being made in terms of treatment?
Yeah, it's a great question, Luke, and you know, there are lots of different answers and no conclusive answers. I don't think anybody knows exactly what causes long COVID and why some people seem to be more likely to end up with long COVID than others. I mean, CDC has now compiled a nice list for us of what that profile looks like, but you're asking the right question. Underneath that, you know, what is the reason why, you know, the biological reason? What's the mechanism by which some people are getting long COVID and other people are not? And we just don't have the answers for that yet. I think everybody is scrambling to get more information.
Okay. His second question is, why is there a difference in the apparent definition of long COVID in the two data sets you mentioned, 4 weeks for LA County cohort study versus the 3 months for the CDC survey?
Yeah, I mean, again, Luke, I think it depends on who is designing the survey instruments and for what purpose. You know, the 4-week definition that was used in LA County by USC is actually, you know, follows the definition that the World Health Organization has set. I think because, you know, as we've, you know, gained more and more information about long COVID, one thing is clear to us that there are a lot of people who have symptoms that either are new symptoms that come after they've recovered from their initial infection or that continue for a while, but somewhere around 6 to 8 weeks, some of those people actually recover. So I think there's been an effort made to really define, for purposes of a survey, a narrower group of people who continue after a 3-month period. I think that's what the CDC did, who continue to experience symptoms associated with their infection. But there's no, I mean, it's neither is right or wrong. They're both capturing a different sort of group of people that would be eligible to give us information about their experiences.
I have one more COVID and one non-COVID. And I'm just going to press you a little bit more, just behind the scenes. Can you give up? Surely you've spoken to Dr. Davis about what do you think is going to happen. You've had discussions about it because it's a big issue.
It's a very big issue, you know, and it's not just Dr. Davis. I mean, you all know here, you know, we have a very big team, a leadership team. We have a lot of infectious disease physicians here. We have a lot of other clinicians. We have a great group of epidemiologists, all who are weighing in. So one of the reasons why it does take us some time to sort this through is, you know, we're data driven. I mean, everybody knows that at this point. And we're looking hard at the information that comes out about what you should do to minimize risks. And what are the patterns that we see as we have more infectious strains that seem to lead to less serious or severe illness. So again, you know, when you think about a new phase, this is in some ways also indicative of a new phase. We have less severe illness because we have better tools and we have more people vaccinated, more people using therapeutics. But that also makes a difference as you assess the risks and benefits of asking people to take one action versus another. So I think my promise is that before we get to the end of March, we will have made that decision, and we will have plenty of time to communicate our decision and also to hear back from folks about concerns. I think we're going to hear from people who want us to move in both directions, because that's where we've been with a lot of the guidance.
Plus a ton of natural immunity as well
A
out
ton
there.
of natural immunity. Unfortunately, that also wanes. Vaccine immunity wanes, particularly for transmission. I mean, both of those seem to not really help us that much on the transmission side when they wane. I mean, that's where we're really seeing the fastest decline in protection, is on the transmission of an infection. We've seen much longer periods of time where people seem to be protected, particularly with vaccines against severe illness.
I did read an article recently about, and correct me if I'm wrong,
Yeah.
that if you get a COVID infection, that is worth a double shot of the vaccine.
I don't think anybody knows that. And I think, again, these are the areas where we're blessed to have a lot of researchers helping us. A lot of the studies are very small. And the thing about natural immunity is, it varies for all of us. You've heard the stories about people who have gotten infected and, 6 weeks later they're infected again. And they're wondering, like, how is that possible? Because it does fly in the face of what most people are experiencing, but it is possible. And unlike with the vaccines, where there's been a lot of clinical study done to measure their effectiveness, it's really much harder to quantify how much natural immunity an individual person has and what are the factors that are going into the variation on that natural immunity. But you're absolutely right that natural immunity has played a big role in providing some protections. Just the durability is always the question. And we're public health people, so we say better not to take a risk. And if your strategy for protecting yourself is to get infected, we would say that's not a great idea. That it's much less risky to get vaccinated than it is to get infected.
All right, I want to switch gears to outside right now.
Outside,
We will experience a
Yeah,
historic
starting to.
storm in LA County. Is your health department team doing anything to help those that are on the streets?
Yeah, thanks so much. I mean, obviously, we're part of some of the street outreach teams. I mean, we have some nurses in particular that work on street outreach teams to make sure that people experiencing homelessness get into shelters. I do want to note that the shelters are all open during the day and in the evening, so that it's no more people have to leave during the daytime while we're in this emergency weather situation. People can call 211 here in the county if they are a person experiencing homelessness to find a place to shelter, and I believe that there's a program that will make sure everyone is sheltered, either at an existing interim housing facility or hotel or motel. I think, we all know one of the groups that is going to be at the highest risk are people who are not housed. I do want to say we've issued some guidance because there are other things that tend to happen when the weather gets very cold, particularly for people who may not have a heating, a regular way to heat their homes. So, we want to remind people, please, 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 you can't run generators inside. It's so dangerous. Please, please, please don't use your stove to heat your house. Be very careful if the electricity goes out about using candles. We recommend you not. And certainly don't leave any candles unattended. This would be a good time today, while it's not raining yet, to go ahead and get a carbon monoxide sensor so that, again, you're staying safe in your house. But it is really, really important that people not bring in grills, et cetera. I know it can get cold for some people and they may not have a way to heat. Better off going to a shelter. We have shelters where you can go to stay warm, or layering up, putting on clothes, using blankets, because otherwise you run the risk of dying from the exposure to the elements that you're using to try to keep yourself warm. So And, you know, carbon monoxide, colorless, odorless. So again, we really want people to be super careful on that. We also want to note it's going to be high winds, so power lines may be down. You know, please don't touch them. You know, again, you know, go ahead and call. You can call 911, report where those lines are down, call 211, but don't touch them. Stay away from them. And again, you know, we urge people who are struggling to stay warm and stay safe to call 211 and get help now, today, right now, before it's really bad weather, so that you're not stuck once the rain starts and the cold weather hits. Thank you.
We're all done.
Okay, thanks everyone. Stay warm, stay dry. So.
Marla, if you want any of that specific text as well, we issued a release on Tuesday. It's on our press release website. There's a lot of the information Dr. Fair just repeated.
Okay, yeah. So it's better to have her voice though.
Yeah.
But
Of course, yeah.
In addition to. Thank you. Thank you so much. Thanks, everyone. Thank you. Okay, stay warm out there, everybody. Yeah, you too. See you in a couple weeks. See ya.
Yeah.
2 weeks. Yeah. Stay safe.